Welcome to 21st Century. I'm Daljit Dhaliwal. Cancer. It kills more people around the world than HIV and AIDS, malaria and tuberculosis combined. And now it's emerging as one of the leading causes of death in Africa. We travel to Cameroon in West Africa to see how one nation is grappling with this growing epidemic.
It is not easy being there. See somebody crying, nurse, please help me, do something. The cancer ward. We live a professional life of people suffering, dying in pain. Cancer is equivalent to death.
For 16 years, 40-year-old Janet Nkenzi has been working in the Douala Hospital in Cameroon in West Africa, living out her childhood dream of becoming a nurse. But since becoming head nurse of the cancer ward 4 years ago, work has become less a dream and more of a nightmare. Known as Africa's silent killer, the number of cancer cases has been rapidly rising across the continent over the last 20 years. According to the World Health Organization, WHO, within the next decade, it's estimated that there will be more than 1 million new cases per year. And if things are left unchanged, Africa will have the highest incidence of cancer in the world by 2030. It's already happening here in Cameroon.
In the
90s, we received about 200 patients per year. Today, we receive more than 1,000 patients a year.
And those are just the few coming in for medical treatment, says Dr. Albert Morley, a cancer specialist or oncologist at Cameroon's Douala Hospital.
There are about 26,000 new cases of cancer per year. The most common of those were breast, cervical and prostate cancer.
It's just the tip of the iceberg, experts say. The reality is that no one really knows the actual number, as many cancer victims simply die, never having seen a doctor and never knowing what killed them. The story is the same across Africa, a continent that has seen an increase in non-communicable diseases. According to the WHO, increased wealth and life expectancy, rising pollution and the movement of people to urban areas where they're more likely to adopt a lifestyle rich in fatty foods, exercise less and smoke more are all contributing factors. Making matters worse, many Africans don't realize what cancer is. Some African languages have no word for the disease. In Cameroon, many believe in traditional explanations. It's a mysterious illness caused by a curse, a spiritual punishment.
They think there's something mystic behind it. They go to the traditional doctor because they think the traditional doctor can do something better than the hospital.
When patients finally realize that they have the disease, it's often too late.
The consequences is that these patients come back at the dying stage to the main hospital, and they're coming only to die.
In fact, Douala Hospital is one of only 2 medical facilities that provide cancer treatment for the nation's 20 million people. There's only one working radiotherapy machine, and it's more than half a century old. As for cancer specialists here, Dr. Morley is only one of 4 oncologists in the entire country.
Most of the young doctors will not want to specialize in oncology. They don't want to be part of that specialty that talks only about death, about pain.
There are no specialized cancer nurses either. Janet eventually became head nurse at the cancer ward, due not to training, but to her dedicated service to the hospital. And worse yet, even when treatment is available, few can afford it.
Here in Africa and Central Africa, in particular, the patient will have to foot the bills, or his family will have to bear the charges. Very few patients have healthcare insurance.
All of this results in survival rates in Africa that are often 50% lower than those of the more developed regions. This despite the fact that many of the cancers are preventable and treatable if detected early. Something Bogla Stella knows too well.
When I developed a growth under my armpits, I went and complained. They said no, that there's no problem with it. So before long, it had developed to cancer.
Bogla was diagnosed with breast cancer 5 years ago and had a mastectomy in a regional hospital. Her husband, Mikkel.
The doctor did not refer us somewhere else for onward treatment. So we're sitting us thinking that everything had been done. Since the breast was removed, we thought that the cancer was already removed.
But Janet knows that the cancer has spread, and it's now just a matter of making Bogla more comfortable in her final days.
What we are doing now is palliative treatment.
Cancer care is almost non-existent in many African countries. More than half of Africa's nations don't even have radiotherapy services. Cameroon is one of the few that even has a national cancer control plan. Set up in 2003, the focus has been on training cancer care professionals, acquiring medical equipment and medicine. But little progress has been made due to the limited resources.
International organizations and foreign countries are not supporting cancer as they are doing with AIDS and malaria. It is partly because they don't have enough statistics on it.
Menga Unganku is a cancer advocate and a member of a growing network of voluntary cancer advocacy groups that has sprung up in the country. Her advocacy group, Splash Cancer Community Care Programme, is determined to help raise awareness about cancer, improve hospital care and encourage people to seek treatment.
We need to carry out a lot of education and sensitization right to the grassroots so that they know that cancer is a disease like any other disease. They know that the earlier they diagnose it, the better. They know that cancer can be cured.
Splash is also promoting cancer prevention, offering tips for healthy diet and lifestyle, and it's donating critical medical supplies such as syringes and saline water to the Douala Hospital.
I'm a volunteer in the Splash community.
They also send volunteers to visit cancer patients.
I said, so there's somebody that even thinking about cancer patient in this country. I was really touched. Anytime you need.
It's something Janet wished that she could have counted on when her own brother died of cancer 3 years ago. She now hopes that the Splash model is replicated across the continent.
We should even make the patients know that even when the cancer is not curable, they can still live with it for 10 years, for 20 years. It is not a matter of cancer today, death tomorrow, no. Madame Muzengale, ça va?
It's time, she says, that the notion of cancer as a death sentence quickly becomes a thing of the past.